FM 104 KUOO Campus Radio, Becky Thorson, time for Becky's Business Beat. And joining me today, Rhonda Wahl, Respiratory Therapy Coordinator with Windom Area Health. Hi, Rhonda.
Hi, how are you?
I'm fine. Today we want to talk about your pulmonary rehab program and chronic lung disease. And can you tell us a little bit about what is chronic lung disease?
Well, chronic lung disease affects your ability to move your air in and out of your lungs with ease, which causes airflow obstruction and inflammation in the lungs. So as the disease progresses, you have increased blockage in your airways, and that will make your breathing a little bit more difficult.
Sure. What is a pulmonary rehabilitation program, and how is the program structured?
Pulmonary rehab, it's a multidisciplinary program, meaning that it's myself and dietitians and pharmacists, and there's a physician involved that structures a program to help patients with the chronic respiratory problems with their breathing. So it's an individualized, tailored program for each individual. So it's going to deal with education and exercise. The exercise is all supervised, and it's based on the patient's abilities. We don't make them work any harder than they can. The goal is to start slow and work your way up and give them education on their lung disease and work again with the exercising to build up their muscles, because you use so much muscles to breathe with.
Who'd benefit most from a program like this?
Anybody with diagnosed lung disease. So that's going to be like your emphysema, COPD, some asthma, or you could get into your pulmonary fibrosis, but it's going to be somebody that definitely has chronic lung disease.
And how does someone benefit from participating in a pulmonary rehab program?
A lot of times just them learning more about their lung disease or helping reduce the feeling of air hunger where they can't catch their breath. It gives them a better quality of life. We stress on the learning of the eating habits. You know, a lot of the times people aren't getting enough protein or enough of the right kinds of foods to help with that muscle mass. And then just to be able to, with the exercise, strengthen them up a little bit more so they can be a little bit more active.
And how can someone get signed up for the rehab program?
With the pulmonary rehab, it does need to be a physician order for the referral, so we just always encourage the patients to visit with their healthcare provider, what they're thinking about their lung disease, and if their physician thinks that this is a good idea. And then from that process, the physician just notifies me. I go ahead and make sure that the patient qualifies with all of the technical end of it. Then I call the patient themselves, visit with them on the phone, then have them come in and do an initial assessment. If it's something that they decide that they want to do, the program is offered right here at the Windom Area Health, and I run the program 2 days a week, and it varies 1 to 2 hours per session, and then the program runs for 6 weeks. And I can be very flexible on dates and times.
That's nice, and individually tailoring it to each person too. How does someone get a hold of you there?
They can either call the main hospital line, which would be the 507-831-2400, or they can visit our website at windomareahealth.org. And then, of course, we always have something on Facebook about the program also.
Okay, lots of ways to reach out there, and thanks for all that great information.
Sure. Well, thank you.
There's Rhonda Wahl, Respiratory Therapy Coordinator at Windom Area Health. Visit windomareahealth.org. It's Becky's Business Beat on Campus Radio, KUOO. FM 104 KUOO.